This morning, North Texas hospitals are overwhelmed as doctors try to keep up with the spike in RSV cases. Cook Children's has called these unprecedented numbers. Cleo Green is with us in studio. We tend to see cases pick up as we do head into winter, Cleo.
Yeah, and it's cold and flu season right now. RSV, as a reminder, is a respiratory virus that has cold-like symptoms. But you got to remember, when your child starts wheezing, that's when there's a lot of concern and things can get severe. I do want to mention here that Cook Children's said that they had dealt with 240 RSV cases in 1 week alone, 500 sick children a day. And take a look, that means patient check-ins were every 3 minutes into their emergency room department. Now, Cook Children's did post this message on X saying respiratory illness is on the rise, causing a jam of patients at Cook Children's ED and urgent care locations. You can actually click on that link to read a bit more and see what they're talking about when it comes to those numbers. Now, doctors at Cook Children's tell us that while it can be serious, most cases are relatively mild and don't require a trip to the ER. They are encouraging patients to avoid, or parents rather, to avoid sitting in a waiting room for hours with a sick child. So if you can, if your little one is experiencing minor symptoms, contact their pediatrician before going to that urgent care or the ER. This will allow doctors to truly focus on their most vulnerable patients.
It's a patient checking in about every 3 minutes to our emergency department.
This is higher than historical volumes in years past and is certainly enough capacity to stretch our resources.
Now, there is a new shot here to protect infants against RSV. It was approved earlier this year, but the supply, it has been limited. A CDC advisory last month told doctors that infants less than 6 months old who have chronic lung disease or other underlying conditions should be given priority. Now, I know this can be a cause for concern. This is when you need to seek immediate care. If your child has a temperature greater than 100 degrees, that's especially for a child under 2 months old. That's when it's considered a medical emergency. Also concerns for dehydration, and if your child is breathing faster or wheezing, definitely need to check out for that. This